Hi, I'm Jordan Wingate. I'm a family physician from Melford, and I'm last, as always. W. Gita's first, I'm last. Always happens. What I've learned over the last 2 hours is you got to go quick. 3 minutes goes really fast. So what I looked at was the emergency room communication specifically between the attending physician in the emergency room and the family physician, and how we judged it was looking at the outpatient sheet that was generated, had that been scanned and faxed into the EMR and reviewed by the family physician. So usually when you look at your current state, this is probably what most of us saw, it was not all good. So we looked at my fishbone diagram. I like this better than the driver diagrams and sort of getting down to my root cause analysis. And it looked like 42% only had actually gotten into the EMR. So we sat down with my team, and the team concept was great. It did morph. I don't know how you guys found it, but my team sort of changed depending on the stage I was at. So when we looked at it with the future state, we came up with using facility admin and some of the front office staff. We came up with a process which hopefully would work. So we did our first PDSA cycle. They were implemented. And this was with QI macros, which is, I thought it was really good, because when you go in and try and talk to people to sell it, and you can show them based on your little changes that what you've done, that it works. So you can clearly see where our decision points were on that. So after our first 10 points, that's where our 42% was. That was our baseline. The next jump up was our first PDSA, and we got to around 90%. And then we made a last adjustment, which then got us up to close to 98, 99% of getting the outpatient sheets into the EMR and reviewed. The 42% was at 3 weeks when I did my initial evaluation. This is at 48 hours after. So we did some really good changes, and we have to now sustain those changes. So we're continuing to do it. We did develop standard work at our hospital for this. This has changed already. Again, standard work, everything changes as we go along, because we're still making small little adjustments to customize the process so that we can continue to get buy-in and engagement by our physicians and actually the front office staff, because this is who it impacts the most, is the front office staff in our hospital. Lessons learned through CQIP. I thought it was a great program. I did the lean training. I thought this was a much more practical use of the information and the training that we got. And like everybody else said, I really enjoyed some of the speakers we had, the coaching that we had. The guy from San Francisco about the QI macros, I thought that stuff was fantastic, and really nothing but positives about the program. Thank you.